By all indications, the wave peaked about 2 weeks ago at an estimated 4,000 infection cases per day. It has since subsided to about 3,000 infections per day. The key strains circulating are XBB 1.9, XBB 1.16, and XBB 2.3, each accounting for about a quarter of all infections. WHO has redesignated XBB 1.16 from being a variant under monitoring to a variant of interest. There is, however, no evidence internationally or locally that any of the variants have a clear growth advantage over the others or can lead to more cases of severe illnesses. MOH will continue to monitor the characteristics of the various strains. There are now over 300 patients infected with COVID-19 and in our hospitals. It is a fraction of the hospitalizations at the peak of the pandemic. That was about Delta wave, about 1,800. Now it's about 300 plus. But nevertheless, that added significant workload to our hospitals. We should also see the number of COVID-19 hospitalizations falling in the coming week as the infection wave subsides. Now, this is the first infection wave we have encountered after transiting to DORSCON Green and treating COVID-19 as an endemic disease. We have weathered through it without imposing any further public health measures. Many members of public, in fact, are even not aware that we are undergoing a COVID infection wave. This is what we have planned for when we transited to DORSCON Green, and it is another important and noteworthy milestone. However, we can maintain this public health posture provided that we continue to take our COVID-19 vaccinations. It is of critical importance that we understand that COVID-19 did not become a milder disease because we transit to DORSCON Green. WHO no longer declare COVID-19 as a public health emergency of international concern, but it also added that it does not mean that COVID-19 is no longer a threat. In fact, it remains a dangerous disease. But our population resilience has strengthened due to vaccinations, boosters, and safe recovery from infections. These are the reasons that enable us to treat it as an endemic disease. So it is of critical importance that we continue to take vaccinations based on MOH's latest recommendations to keep the level of our resilience high.